Hello, and welcome to today's presentation of our Tackling Toileting webinar series. Today is the second webinar in our series and looks at the topic of toileting schedules and self-care routines. My name is Bethany Bruin, and I am an occupational therapist, as well as being part of our subject matter expert team here at Autism Ontario. I'm joined today by my colleague, Kristen Gunby, who is a behavior analyst and also part of our team. Just a reminder that this presentation was pre-recorded, and after the recording plays, we will have an opportunity to answer your questions. So please feel free to enter your questions in the Q&A box below, and we will do our best to answer as many questions as we can. So let's get started. So we're going to pick up where we left off, and if you haven't had an opportunity already to view part one of this mini-series, the link to access it is in our resource section as View on Demand, register for upcoming sessions. So please feel free to check it out there. In part one of our mini-series, we discuss communication, social and environmental considerations to think about or get support with, either before or during your toileting journey. Today is part two of our mini-series, and we'll be sharing information about supporting toileting, including urine and bowel movements, as part of your daytime routine. We will also be discussing self-care routines. Just a reminder that the content for this mini-series is from our new toileting guide. So if you have a chance, you can take a look at that in the resource section as well. It is listed under presentation slides and resources. So let's get started with looking at how we can support toileting as part of our daily routines. An important aspect of toileting for children is learning about their body and the cues that it's giving them to know when to go to the bathroom. Sometimes we refer to this as being self-initiated or self-initiating their toileting routine. Our cues for our body are connected to our sense of interoception, or the internal cues or sensations that tell us things about our body. For example, if our stomach is rumbling or feels empty, we might connect that to feeling hungry. Or if our bladder feels full, we know that this means we need to urinate or use the toilet. As we learn to connect these internal sensations to needs like eating or drinking or using the toilet, these actions become self-initiated. In other words, when we feel the need to urinate, we initiate stopping what we're doing, going to the washroom, and using the toilet. So until your child can recognize and communicate that they need to use the bathroom, you may want to set up regular times for toileting as part of your daily routine. This is what we refer to as schedule trained. Older children, youth, and adults may also benefit from setting up a schedule as well. And you can use an app on their device to set reminders for taking a break or using the washroom. Some suggestions for when to schedule toileting into your daily routine are things like when waking up in the morning or after a nap, before or after an activity, such as a structured play activity, a therapy appointment, going to the park, going for a walk, before a meal or a snack, before leaving the house, such as for a community event or going to school, as well as before going to sleep, either bedtime or nap time. So we kind of look at those regular routines during our day, and we try to pair our washroom breaks to go along with them. Now I'll pass things over to Kristen to talk about self-care routines.
Thanks, Bethany. There are other routines that can be part of toileting, aside from actually using the toilet to urinate or have a bowel movement. These are things such as hand washing, wiping, getting dressed, etc. We're going to refer to these as self-care routines. Now, each of these self-care routines is often made up of several steps and requires some support when we want to teach these routines. Next, we're going to touch on some evidence-based practices or techniques for teaching self-care routines. We want to remind you that not all teaching strategies are appropriate for all children, so it's helpful to check with the professional you're working with to help you understand whether these strategies would be a good fit for your child. The first strategy or technique I want to talk about is called a task analysis. Self-care routines can include a lot of different steps that can be overwhelming to teach all at once. Often professionals will break down the routine into smaller, more manageable steps that can be taught a little at a time or all at once, depending on the individual. The way this works is for the overall skill to be broken down into little steps that are needed to complete the skill. For example, hand washing can be broken down into the following steps: turning on the tap, wetting hands, putting soap on the hands, and so on. Next, your child may need additional assistance called prompts. A prompt is a specific form of help given by someone else to support the person with the skill they're learning. A variety of prompts can be used to help someone. There's verbal prompts, visual prompts, physical prompts. The type of prompt used depends on an individual's unique needs and preferences. Keep in mind that prompts are help, and once your child starts to understand the expectations, it's important to consider lessening the help over time so that your child can continue to build independence. Once your child demonstrates the skill or part of the skill you're focusing on, it's important to deliver something fun and exciting. This can be a special toy, an activity, or praise. Rewards or positive reinforcement are used to acknowledge your child's efforts in accomplishing the routine. Doing this can make the experience positive and increase the likelihood that that skill will be shown again in the future. And then we want to keep on practicing. We repeat the whole thing. We present the routine by breaking it down into smaller, more manageable steps using the task analysis. We can use prompts when needed to assist the individual. And then we want to acknowledge their efforts by rewarding them with positive reinforcement. Repetition and practice can help with progress.
So now we have some additional tips, and you can refer to your toileting guide that we mentioned earlier for more details about each of these. Our first tip is around choice or preference. So we want to consider your child's preferences and their choices when selecting materials. This can help improve performance on self-care tasks. And some examples might be having your child help you to pick out a hand soap with a scent or a pattern that they like, or letting them select which towel they want to use to dry their hands with. For older children, you may want to consider taking your child to the pharmacy to select their own menstrual products. Our next tip is around clothing, and it's often helpful for children to wear clothes that can be easily removed. For example, loose-fitting pants with an elastic waistband. When you're considering diapers or training pants, many therapists recommend switching to underwear early in the toilet training process. Sometimes diapers and pull-up style training pants don't necessarily allow your child to feel that full sensation of being wet or being soiled. In terms of underwear, some children don't necessarily like that feeling of underwear and they prefer to wear nothing under their clothing. This might be something to consider, of course, keeping in mind your child's preference as well as what your family's comfortable with and any cultural practices. Our next tip around hand washing, we're thinking about using a stool with handles that may help your child to easily reach the sink. Soap and towels, again, should be within reach. And if your child enjoys sensory play, washing their hands with soapy bubbles might be a rewarding activity in itself. Our next tip is around wiping, and your child may need support learning how to physically wipe themselves. So, for example, reaching around back to wipe their bottom after a poop, or how to wipe from front to back for pee. Your child might need help knowing when to keep wiping and when they can stop wiping. So, in other words, visually checking the toilet paper to see whether it's dirty or clean. Your child might need help knowing how much toilet paper to use. You might need to start by placing small predetermined amounts of toilet paper out for your child to use, and then slowly build towards having the whole toilet paper roll available. And some families may not use toilet paper or wipes at all. For example, some cultures use a jug with water to wash after using the toilet. If you're comfortable, you might want to share with the professionals that you work with what your family or cultural practices are so they can help to support your child in learning what is important for you and your family. Our last tip is around routines related to menstruation. And we want to consider practicing opening packaging, proper placement on underwear, and appropriate disposal before menstruation begins. This can be helpful for your child to feel confident and competent before they need this skill. You can speak with your family doctor or pediatrician to see if they have any additional tips or suggestions for you. Some of these routines and teaching strategies you may feel comfortable with tackling on your own, and maybe you've already tried some of these strategies and you know what works for you and your family. And other strategies may require more support. When looking for support with self-care routines, you might request the support of an occupational therapist an OT, or a board certified behavior analyst, a BCBA. So to summarize today's discussion about toileting schedules and self-care routines, here are some key takeaways. Until your child can recognize and communicate that they need to go to the bathroom, you can set up regular times for toileting as part of your daily routine. There are other self-care routines that can be part of toileting. Some examples include dressing, hand washing, and menstrual care. Teaching these can help to further support your child in being more independent. And now we will have an opportunity to answer your questions. Hi, everyone. Thank you for your patience, and we do apologize for the technical difficulties. Kristen and I were here in the background answering all your questions, but apparently none of you could hear us. So we will go back to the beginning and get through some of those questions. So again, thank you for your patience. And just to note that because this is a 4-part series, there are some questions that have been asked that were asked previously on our first webinar on Monday that we'll be answering today, and some that will be more relevant to sessions going ahead. So I will back up a second and we will talk about the concept of interoception. So some folks were asking examples about what do I do when my child is independent in toileting steps, but only goes to the toilet when given direct instructions. He will only come to me after he's had an accident. Or how do we start to teach our children, my 5-year-old, to listen to her body so that she goes to the potty on her own? So we touched really briefly on that during the recorded part of this presentation, this concept of interoception, or our internal sensations. So that's where we're taking sensations from our body, like whether we're hungry or full, whether we need to use the washroom, and those senses develop as we get older, and sometimes they take a little bit longer for children on the autism spectrum. A great resource you can check to learn more about interoception and to find some activities you can work on to develop that skill. Kelly Mahler is the name of an occupational therapist who's done some great work in the field of interoception. So that's a great one to check out. And if you're working with a therapy team, you can check in with your occupational therapist about some other skills that you can work on in that area. So I will pass it over to you, Kristen.
Okay, so we've got a question about self-care. Any tips on kids who hate having hair brushed and won't do it themselves? I would suggest using the task analysis process to break down all the steps of brushing your hair. Maybe keep it simple and successful at the start. You could use some detangler and maybe just have one successful brush and then acknowledge their efforts with some positive reinforcement and build from there.
Thanks, Kristen. We also had some questions around wiping. And again, in the recorded part of this presentation today, we talked about a few of those pieces where looking at toilet paper, so how much we're using, maybe having a preset amount, checking the toilet paper to see if it's clean or if we need to continue wiping. If you're working with a therapy team, that might be something that you practice. For example, an occupational therapist might have you use a balloon and some shaving cream to practice that action of wiping, just to get used to that idea outside of the bathroom situation. And again, in our first presentation, we talked about the environment where we were thinking about how our child is sitting, how stable they are, if their feet are supported. So that's a great place to start when you're thinking about wiping, because they do have to move and shift their weight as they're practicing wiping. So you might want to play around with different positioning. Maybe you're practicing wiping in standing. Maybe you're practicing wiping in a squatting position. You might want to start by using wipes, wet wipes that can be a little bit more efficient sometimes than toilet paper. And then maybe transitioning again to sort of measuring out how many squares of toilet paper you're using before you're getting to using the full roll independently. And we will be talking more about toilet training specifically for pee and for poop in our next presentation.
Okay. I'm just going to the answered questions because we thought we had answered this, but we weren't on the air. And I wanted to answer this question on how do you suggest approaching toilet training with a child with significant aggression and non-compliance? Positive reinforcement has not worked for this individual. Will toilet training not become more difficult the older the child gets and more accustomed he or she gets to diapers? So Toilet training can become more difficult the longer things go on with getting used to diapers. But if you are adding toileting onto an individual's plate who's just not really feeling regulated and they're upset, then I think that that would be more likely to be unsuccessful. And so I would suggest working with an occupational therapist or board certified behavior analyst to really look at the underlying reasons for why this individual is upset so that they can come up with some strategies and a plan to help the individual get their needs and wants met in an easier and safer way, and then focus on toileting. So I wouldn't do those two things together. And we do talk about in part 4 a little bit more about challenging behavior.
Thanks, Kristen. There's a question around what is the best approach for a child that knows the routine and knows the cues, but still needs to be regularly reminded. So one of the kind of tips and tricks that I like to use to take some of the pressure off of that parent or caregiver and child dynamic. So rather than you being the one that's reminding all the time, sometimes we can set up things like having visuals where we're using a first then or a visual timer that's showing when it's time to use the washroom. We like to use we have an Alexa at our house, so we like to use that for transitions and for reminders. So again, it's not coming from me as the parent, it's coming from an external source, but we can still set that up to be those regular reminders of when it's time to take a break and to use the washroom.
And on Monday, in part 3, we will talk a little bit about some other pieces like a urine sensing alarm that can support in awareness and knowing when you start going pee, having an alarm set off to draw attention to those that are supporting that individual, that maybe it would be a good time to support them and prompt them to the bathroom.
Just looking through your questions. Thanks. There's so much interest here and there's so many great questions. So we're trying to get to as many as we can. And just to let you know that we will be extending our presentation by a few minutes so that we can get to a few more of your questions. So again, our apologies for the technical difficulties and thanks for your patience. Someone's asking to repeat the answer about when a child is ready for toilet training. So that readiness piece, which again, we're going to get into on Monday. But Kristen, did you want to repeat that piece a little?
On readiness, or was that about challenging behaviors?
Sorry, they're saying to repeat the answer about when a child is ready for toilet training. So that is something that we're going to be addressing on Monday. And unfortunately, again, our answer is going to be that it's such an individual piece. There's lots of things that we'd like to sort of have in place as far as, Monday we talked about things like our communication system. We talked about having our environment set up, but it is also going to be very individual depending on where your child is at developmentally and sort of where your family is at in that process. So we'll touch on that again on Monday. Just reading through your questions still. So someone is asking, how do we make a child sit more time in the toilet? He needs to get up as soon as he's done with peeing and he's not sitting for pooping. So that was one of the strategies we talked about on our first presentation, was just around that motivation factor. So sometimes it's helpful to have something special that's a motivating or a preferred activity that only happens during toilet time. So whether that's a special book, maybe that's a song, maybe that's something that you as a caregiver or a parent are doing as an interaction that's more playful, that's motivating your child to sit for a little bit longer, and that keeps that time special just for toilet time.
I see here. So we've tried to incorporate toilet training into my child's routine. However, most of the time my child will refuse to go. How can I handle this situation? My child doesn't want to go, and this will occasionally cause accidents to happen. It's the same in school. So the first thing, great that you're communicating with school so that you're understanding what they're doing and they're understanding what you're doing. In part 3 on Monday, we are going to talk about some pieces that can help increase success on the toilet, like the urine sensing alarm, increasing fluids. But it's also important to just keep an awareness of maybe why your child's refusing to go. Is it that they feel they don't have to go and there's not the opportunity? Or are there things in the bathroom that might be scary or upsetting? And really trying to figure out and investigating why your child is not going to the washroom. A board certified behavior analyst, as well as an occupational therapist, can help you identify what's really going on and then come up with a plan to support your child.
Seeing lots of questions around communication and around how do we encourage my son to communicate the need to go to the toilet, or sort of how do we work on that communication piece around toileting. And we would encourage you, if your child is eligible for or is a candidate for augmentative communication, our colleague Tracy Lindblad does have a 4-part, I believe, series on augmentative communication that you might want to check out just as sort of an extra piece. We did touch upon on Monday talking about different methods of communication, but sometimes it's also helpful, depending on your child's age and where they're at developmentally, that they're initiating, again, they're going to the washroom as their form of communication, right? Sometimes it doesn't need to be something where it depends on if they're asking for our help and assistance with using the washroom, or if they're indicating to let us know that that's where they're going, or if they're just self-initiating and moving towards the washroom as part of their communication.
I see here, my daughter's 6 years old. With the help of a BCBA, she's now urinating, but there's still some troubles with having a bowel movement because the individual wants to stand and not sit. There has been some success with bowel movements, but this has made her a little bit more resistant. So we are on Monday going to get into daytime toilet training for pee and poop, and it is a process. So sometimes when you're doing toilet training for urine, you do get toilet training for bowel movements kind of for free, and sometimes you don't. And so behavior analysts and occupational therapists will be collecting data along the way to really understand whether your child needs more specific training for daytime toilet training for poop. So it sounds like you're already set up with a professional. There may be some additional tips and tricks on Monday that we'll talk about. Daytime toilet training for bowel movements sometimes can involve a more multidisciplinary or interdisciplinary approach where you're working with dietitians and medical professionals as well. So yep, stay tuned next week for more on that, but it is a process and it doesn't always happen at the same time.
We have a few questions around sort of the school setting, as well as encouraging toilet training at daycare, so a childcare setting. So kind of touching back on that piece around what we're working on or how we're being consistent with things that we're doing at home versus things out in the community, whether that's at school or in a daycare setting. So really, again, that's going to depend on your communication with your school team or with their daycare team, their childcare team, around what approaches they're taking at school, what approaches they're taking at daycare. And sometimes it's helpful to set up a time to have a meeting specifically around that goal. Or if you can pull in, if you do have a therapy team that you're working with at home, if you can pull in some of those written goals or reports that can transfer over to, again, your school team or your daycare team to try to have that integrated approach.
I see here a question. If your child doesn't like the sensation of poop in their pull-up and tries to take it off, is it better to try the naked method for potty training? So that's a personal decision. I will say, however, a lot of the common teaching strategies that are evidence-based, one of the first things they start doing when they work on daytime toilet training for urine and bowel movements is make the move during the day from diapers to underwear. And the fact that this individual doesn't like that sensation is not necessarily a bad thing. It's showing that maybe they don't want to soil that diaper, and maybe the move to underwear and working with a professional on the next steps for that might be an indication that maybe they're ready to start having some bowel movements on the toilet.
That's great that you addressed that, Kristen, because I know we have lots of questions about sort of that difference between using pull-ups and using underwear versus kind of having nothing on. And again, that will be a very personal decision, but keeping in mind that sometimes those pull-ups do limit that ability to experience that sensation. So sometimes it's nice to have more of an awareness, but from a convenience or from a convenience perspective, sometimes we do need to have those pull-ups in place just to prevent those accidents.
And it's also good to start thinking about whether underwear is right for your family or not, especially if you think about future skills like menstruation and wearing a pad. Sometimes it can be hard to use an adhesive if there's no underwear. So just something to think about.
So I think we have time for maybe one or two more questions. And just to note that at the end of this presentation, you will have an opportunity to give us some feedback through a survey. So again, thank you for your patience with our technical difficulties. And please feel free to let us know with your feedback if you do have suggestions.
There is a question here on nighttime bedwetting. We do get into that in part 4, and we really apologize for continuously telling you that these are just in different parts. There are tips for nighttime bedwetting. It is important to highlight that daytime toilet training can be very different than nighttime toilet training. Sometimes there's more of a medical lens on reasons for bedwetting at night. There's things that happen to the body that get you ready for holding it throughout the night that don't necessarily happen early on in childhood. And so we will be talking about knowing when it's time to tackle nighttime urination. So stay tuned. That will be next Wednesday. Okay. So I think we're just about out of time. Thank you guys for your questions. And we really appreciate all your patience with the technical difficulties. And please fill out the feedback surveys if you can. It just helps us improve our presentations going forward.
And we will hope to see you back here for our next session on Monday. Thanks everyone for joining.